The Armed Forces Health Surveillance Center, or AFHSC, is charged with a critical element of force health protection. It accomplishes that mission through medical surveillance. The word surveillance comes from the French word surveiller, which means to watch over. AFHSC does just that. It watches over the health of all those who serve our nation in uniform. But what does that mean?
Epidemiology, preventive medicine, is really medicine of populations, to understand what causes illness, what are the trends of illness, how can we impact the illness of whole populations, of whole groups, whether it's a city, whether it's a country, whether it's the military.
The AFHSC was created by the Deputy Secretary of Defense in 2008 to merge several strategic Department of Defense health surveillance assets into a more comprehensive, unified effort in force health protection.
Why are we interested in medical surveillance in the military? This is of vital importance. There are certain pathogens out there like respiratory diseases, like influenza, which has been famous for sidelining large fractions of a military's troops. But also there's other diseases that are vector-borne, mosquito-borne illnesses like dengue fever, which has been known to go through a town and affect 10% of a population, and it can kill 1 to 2% of those that are infected with it.
The AFHSC builds the Surveillance Foundation for Force Health Protection in 4 distinct stages.
Collecting information is where you need to start. And we do that at the Armed Forces Health Surveillance Center within our service members and within global populations and through the overseas labs.
Each of the services has had their own surveillance hubs for many years, and they do just fine. But they're limited to working on their own respective populations.
The Armed Forces Health Surveillance Center is unique in its ability to look at diseases and health challenges across services at the DoD level.
Our interest is in collecting information about the occurrence of disease and injury in military personnel and family members. We primarily do that by examining the data which is contained in a data system called the Defense Medical Surveillance System. And that's a huge administrative database which reflects healthcare delivered to our beneficiary populations.
Another one of the resources that the Armed Forces Health Surveillance Center brings to the table in this international community is our DoD Serum Repository. So every member of the military has frequent HIV draws. In one person's career, we might have in our freezers here at the Armed Forces Health Surveillance Center 8, 10, or 12 samples from that individual. And from that individual, we also know when you were in Afghanistan, when you were on board a ship, when you conducted this exercise or that, or had this specialty. Those exposures are important when it comes to health. It's a very rich resource that no one in the world has other than the U.S. Department of Defense to the extent and breadth that we have. It's definitely the largest serum repository in the world.
Combined, the DMSS and DoDSR provide an unrivaled resource for conducting military medical surveillance, clinical care, and sero-epidemiologic investigations.
Another component of AFHSC's strength is its global reach. To enhance situational awareness, in 1997, the Department of Defense created the Global Emerging Infection Surveillance and Response System, or GEIS. Ahead of its time, GEIS quickly became a respected authority in the fields of research and surveillance about emerging infectious diseases and endemic diseases throughout the world. Today, GEIS funds projects primarily through the 6 U.S. labs run by the military services and strategically located in Peru, Egypt, Kenya, the Republic of Georgia, Thailand, and Hawaii. GEIS focuses on 5 surveillance priorities: respiratory infections, gastrointestinal infections, febrile illness syndromes, antimicrobial resistance, and sexually transmitted infections. Currently, there are GEIS projects in more than 70 countries being conducted through Army, Navy, and Air Force labs and partners.
The global aspect of what we do is important to the U.S. military because the U.S. military is throughout the globe right now.
AFHSC also works in partnership with other organizations within the world's public health community for a larger global surveillance presence.
Our population is an incredible resource to be able to work together with the CDC and the World Health Organization. Our population is well-defined, well understood. We have exposures throughout the world, and we have the ability to contribute to the global public health portfolio.
Once AFHSC has sought out and gathered data on emerging infections and other health-related threats to military personnel, the information gets analyzed and interpreted to support the development of health protection strategies. The Epidemiology and Analysis Division accepts requests for data analysis from military leaders, DoD officials, policymakers, and other interested parties.
The Defense Medical Surveillance System is the tool that is used to create a lot of our analytic products. But accessing the data in that is not simple. It's not a matter of just opening it up and the data's there in the form you want.
Analysts use sophisticated algorithms and computer programs to identify risk factors for disease, assess emerging health threats, conduct deployment surveillance, and support serological studies in response to requests from throughout the DoD. The process of analyzing data from the DMSS is a complicated one that takes time and expertise in epidemiology and biostatistics to consider all the variables required to properly and completely answer a request. The third part of the surveillance process is to disseminate the results and findings of analysis. AFHSC does this in a variety of ways. It can be done through a written report created specifically to address a request, or results can be disseminated through other media. Getting the research and data to combatant commands, DoD leaders, and medical professionals is a key component of AFHSC's work.
MSMR is the acronym for the Medical Surveillance Monthly Report, and it's a monthly scientific publication which is published by the Armed Forces Health Surveillance Center. The bulk of its content consists of reports or articles or descriptions of the results of data analyses performed here at the Surveillance Center.
In 2011, the MSMR was added to Medline, the National Library of Medicine's online searchable database of medical publications, thereby increasing its accessibility and impact on the global health community. In addition to publication in the MSMR and other scientific journals, the results of AFHSC's supported studies are also shared through briefings, reports, and training.
We do a lot of training to help individuals, both military and non-military and general public that are interested in particular topics. So we do a lot of training, trying to disseminate the knowledge that we accumulate. And hopefully all this is going to be translated into action, policies, and programs that will change the health of the population and will make a particular fighter or soldier be healthier when staged or in action in developing countries.
Public health surveillance means nothing if there isn't the intent to act on that information. By putting out the products we do, by attempting and doing everything we can to get that data that's actionable into the right hands, then the different organizations within the DoD that have the primary responsibility for either setting that policy or going out and working with the populations have the data they need to do their work.
Investigation, analysis, and dissemination of information can affect policy and force health protection only if it is acted upon. The AFHSC is committed to getting its medical surveillance data into the right hands to enhance force health protection. AFHSC does this by engaging with policymakers, combatant commands, and public health leaders. By supporting surveillance studies and being able to analyze data on the healthcare of the U.S. military population, AFHSC is able to recommend actions ranging from use of influenza vaccines to control of emerging infections to assessing traumatic brain injuries in theater.
There are so many ways that the U.S. military has contributed to global public health.
GEIS studies monitor global health risks from emerging infections and specific geographic ailments. These projects offer another level of data to AFHSC's database. For example, there are ongoing projects at NAMRU 6 in Peru that are investigating dengue fever and other vector-borne diseases.
This research project in particular, we're looking at patients sometimes 3 months, sometimes 6 months, sometimes 12 months after an initial tropical viral illness. And very little is known what happens to these patients 3 months after they get sick, or 6 or 12 months.
There's a possibility that, once we determine what that true disease burden is, that these populations might make appropriate study groups in terms of, vaccines for malaria, and these would definitely be of significant importance for our armed forces if they're either deployed or located in an area where diseases are endemic.
The AFHSC is currently working at integrating DoD and global biosphere data even more comprehensively to provide even more health situational awareness for our geographic combatant commands and partner nations.
I have a vision that we really can leverage the products that we produce for our service members to benefit global public health as well, and thereby global health security. Our primary responsibility has got to be our uniformed men and women and their health as they're going throughout the world and protecting the freedom that we have here in this country.
To find out more about AFHSC and force health protection, visit www.afhsc.mil.